verify it, gather our equipment, wash our hands. Hi, my name is Colleen. I'm your nurse today, and we need to put in a feeding tube. Is that okay with you? I provide privacy. Okay, so we're gonna get this inserted. It goes into your nose, and while we're doing this, I need to raise the head of your bed. It's a lot easier to insert. So the doctor would like you to have this temporarily to help give you some additional nutrition since you can't eat for a few days. Make sure this pillow is behind shoulders so she's nice and straight up for us. I need to take a look at your nose to see if there's a difference or one side's better. Have you ever had any nasal injuries or surgeries? She says she hasn't. Pen light if I have it. Here is a tissue if you want to blow your nose first. Okay, so I'm ready to put my gloves on. I would take a towel and have it available for her. So I put a towel on. I left that in the room, so. Okay. So I have my cup, I have my straw. I'm going to get some tape ready. One for marking the tube, and then one for the cheek, and then one other one for when we're ready to do the final secure. So I'll do that. And then I'll do one for securing to the cheek. And then our final one for the nose that we'll use, sometimes there are nasal strips that are already prepared, but we're going to have this one be kind of split right in the middle for when you're gonna get ready for final securing. And I'm just gonna put this over here so it's set. Okay. So here is an emesis basin if you feel like you're gonna be sick or anything, okay? Says it's fine. And then there will be a point where I'm gonna give you a glass of water because to help the tube pass more easily, we're gonna have you swallow. She says that's fine. So I am now ready to get my tube out of my package. And I did verify my order. It is a Salem Sump 12 French. Okay, so the first thing I need to do is measure this because we want to make sure we get this into your stomach. So we're going to start with the tip of the nose to the tip of the earlobe, and then we'll take that and go on down to the mid-umbilicus or your xiphoid process. And that is right around 57. So I'm just gonna mark this so we know how far to advance it. And make sure I've got that right. Okay, so we're good. So I'm gonna have you keep your head nice and straight for the moment. If you have any troubles with this, put your hand up so I can stop if need be. So I'm going to lubricate the tip about 4 inches, and we're going to begin. And we're going to advance till we know it's kind of the back of that throat. I can now see the tube, so I'm going to have you take your water and straw, and we're going to tilt your chin forward, and we're going to continue to advance. So if you can swallow while I do this. While I'm doing this, I'm observing for any respiratory distress, any evidence that this is going elsewhere, like the lung. We're looking for any trauma. And I've learned that this tube won't go any further than this, so we're pretending the tape is up there. I'm temporarily going to secure it to the cheek until I do my verification processes. So at this point, if I had the x-ray tech up here, remember x-ray is the gold standard, we'd have them do an x-ray to check. I'm going to ask my patient, can you tell me how you're feeling? We want to make sure they can speak, looking for any respiratory concerns. Now we can take off this, and we are going to see if we can draw some abdominal gastric contents. And we can, and it would be yellow, greenish, brownish, white, and kind of curdled looking. So now I'm going to take this and put a little bit on my litmus paper. pH should be between 1 and 5.5, so we know that it's acidic contents from the stomach. I'm going to put back in what I took out. Before proceeding, I am going to fully secure my tube now that I know it's in the right place. So we're going to take that off and take this one. I didn't cut it very nice, but so we're going to secure it to the nose, and you could probably make it a little shorter than this one. Then you're going to go underneath and around, and take the other one and go underneath and around, and make sure it's secured to the nose. Then we need to make sure we're securing this tube to the gown. So you could either take a rubber band, tape, and make sure it is secured to their gown. Good point at this to auscultate lungs after, just to make sure there's no problems. If we're going to give meds, we are going to take this out. We're going to flush. Again, if it works, we can do this via gravity, depending on the tube. We'd make sure to put in 30 cc's, and we'd have those little med cups so we could measure. Take a med, give them their med, see how they're doing. Then you're going to have to flush between each med if you have multiple medications you're going to be giving. So once we're done with that, we are going to make sure that we close this up. Make sure it's secure. How are you feeling? Did that go okay for you? Okay, so I'm going to put your head down a little bit, but because you have this feeding tube in, we need to keep you elevated at 30 degrees because you could have the risk of aspirating or the tube going into your lung. So we're going to get the head of your bed down. And if I was taller, I would have moved the bed to working height. Are you in any pain at all? Denies any pain. I would clean up all of my supplies, take off my gloves, wash hands. Here's your call light. Can I get you anything else? Make sure bed's locked, open my curtain. Then I'm going to document how the patient tolerated the procedure. That I put in what I put in. So Salem sump, size 12 French. I'm going to put in how I verified it, at least 2 methods, which could be a combination of x-ray. Also check the back of the throat during insertion to make sure that tube's not coiled up in there. Gastric contents, pH. If I have a capnography, you put that on the end and you can see what the CO2 levels are. I'm going to document what contents came out, what they looked like, how much came out, what they smelled like, what I injected back in, what the pH was, and then that's about it. So then I would have everything done